Hi everyone. On behalf of the Senior Dental Care team, I would like to welcome you to this webinar today. My name is Jeanie Jandak and I have been a practicing dental hygienist for 29 years. Currently, I practice dental hygiene for senior dental care in nursing homes in the Chicago area. I absolutely love caring for my patients and I'm excited to bring this information to you today. In today's webinar, I will be discussing how to care for the oral health of your residents. I will review basic oral hygiene techniques that you can use to help keep your residents' mouths clean and healthy. Today's focus will be on the care of natural teeth. Should you have any questions about this information, you can enter the questions in the question and answer box below, and they will be answered immediately following this webinar. You can also email questions directly to me at jjandak@myseniordentalcare.com. Keeping your residents' teeth and mouth tissue clean can reduce the incidence of cavities and oral infections, which in turn greatly affect your residents' overall health and well-being. Helping your residents to maintain good oral health can significantly decrease the incidence of common major health issues like pneumonia and MRSA. There is a psychological aspect to poor oral health as well, which can have a huge impact on your residents' overall emotional well-being. Research has shown a strong relationship between gum disease and many mental health issues like stress, depression, distress, anxiety, and loneliness. First, I would like to explain what plaque and calculus or tartar is and why it is so important to remove this debris from the mouth. Plaque is a soft, sticky substance that is produced by the bacteria in the mouth. Plaque sticks to the surfaces in the mouth like your teeth, gum tissue, and tongue. 1 cubic millimeter of plaque contains 100 million bacteria. Plaque causes bleeding, swollen gum tissue, and plaque causes destruction of teeth. The harmful bacteria in plaque can enter the bloodstream through the gum tissue and cause many health issues in the body. Plaque bacteria can also be breathed into the lungs and cause respiratory infections, pneumonia, and acute bronchitis. When plaque is not removed regularly by brushing and flossing, it can harden into calculus or tartar. Calculus or tartar is plaque that has mineralized and hardened. Calculus cannot be removed by brushing or flossing. A professional dental cleaning is needed to remove calculus. Even though you cannot remove calculus with a toothbrush, it's still very important to brush around the buildup daily to remove any newly formed soft plaque. Before I talk about how to clean a resident's mouth, I would like to give you some tips on how to best approach the resident to ease compliance and help you gain better access to the mouth tissue and teeth. When approaching the resident, try to be at eye level with the resident. If the resident is in a wheelchair, bend down to their level or sit in front of them in a chair. If they're in bed, raise the bed so that you're at eye level if possible. Bedridden residents should have their head elevated to prevent choking. Explain to the resident what you are about to do and show them the toothbrush so they understand. With dementia residents, this will help to minimize confusion. If you have a resident who is hard of hearing, lean close to their ear so they can hear you. Be gentle in your approach, move slowly, and touch gently. Always inspect the resident's mouth before brushing to assess for removable appliances such as partials and dentures, or abnormal findings such as sores, swollen tissue, cracked or loose teeth. A tongue depressor can be used if available to hold the cheeks back for better access. Any abnormal findings should be noted and a dental visit scheduled if needed. Partials and dentures should be removed before brushing. It is important to understand that the information I'm sharing with you today is intended for the caregiver. These techniques are meant to be simple yet effective. So let's talk about toothbrushing. The toothbrush should be clean with soft bristles and a small head. The bristles should be uniform and not frayed, as this could scratch the gum tissue. Use a pea-size amount of fluoridated toothpaste or just water. Try to work in sections at a time so as not to miss any areas. Work back to front, upper first then lower. Establish some kind of pattern if you can. Use a gentle circular motion and light pressure, concentrating on the gum line on both sides of the teeth, the cheek side and the tongue side. It's very important to remove debris from around the gum tissue. Have the resident close slightly to relax the cheek muscles for better access to the cheek surfaces. Gently brush the chewing surfaces and gently brush the top of the resident's tongue. A clean tongue will be pink in color. Plaque will be removed easily, however, calculus and tartar will not come off with a toothbrush. A professional cleaning is needed to remove calculus. Bleeding may occur if inflammation is present. However, with consistent daily brushing, you should see this bleeding and inflammation subside. Be aware that a resident may bite down on a toothbrush as well as your fingers. Keep your fingers away from biting surfaces of the teeth. If a resident bites down on the toothbrush, do not pull the brush. Just let up on the grip and gently ask the resident to open. Forcing the brush away will only cause the resident to bite harder. Have the resident rinse between sections if necessary, or an oral swab moistened with water can be used to wipe the teeth if the resident is unable to rinse. Rinse the toothbrush thoroughly after use and remove all excess toothpaste from the brush. Store the resident's toothbrush in an upright position in a cup or holder and allow it to air dry completely between uses. Do not store residents' toothbrushes together in the same cup or holder to prevent the spread of bacteria. Toothbrushes should be replaced every 3 months or after a contagious illness such as a cold or the flu. A resident that has inflamed gum tissue may not be able to tolerate brushing due to it being painful. Using an oral swab or a washcloth to remove plaque and food debris may be tolerable for the resident until the inflammation subsides. Dipping the swab in antibacterial mouth rinse such as Crest Pro Health or Listerine Zero can also be beneficial in helping to bring down the inflammation. Oral swabs can be used to wipe debris from teeth and oral tissues or to apply antibacterial mouth rinses. Oral swabs can be used to remove food debris from the vestibule of the resident's mouth as well. And the vestibule is the area where your cheek and lip tissue connects to the gum line. 2-minute brushing is recommended once in the morning and once before bed. However, if there is a resident who is more compliant at another time of the day, then brush their teeth at that time. Some residents are more compliant with certain caregivers than others, and if a resident is not cooperating with you, have another caregiver try. You may have a resident who will not cooperate at all one day, but they might be fine the next. It's important to keep trying. NPO residents that cannot have anything by mouth still build up bacterial plaque in their mouths. Brushing with a water-dampened toothbrush and no toothpaste or using a water-dampened oral swab is recommended. Food debris that's stuck between the teeth is not always removed during brushing. It is very important to use floss or use an interdental aid to remove food debris from between the teeth to prevent swelling, inflammation, and discomfort of the tissue in that area. Ideally, flossing should be done at least once a day, preferably before bedtime, and always when food debris is stuck between the teeth. The use of a floss handle or flossing stick is recommended as it is easier to access the back teeth and avoid being bitten. Begin flossing in the posterior area and work around to the other side in a pattern so as not to miss any areas. Move the floss up and down between the teeth, holding it against the tooth surface. Never floss in a sawing motion, as this can actually cut the gum tissue. Soft picks or proxa brushes can be used instead of floss to clean between the teeth. They're very easy to use, and you use them in and out just like a toothpick in an in and out motion. Bleeding may occur during flossing or cleaning between the teeth due to inflammation, but should get better with consistent daily cleaning of the area. Let's talk a little bit about oral rinses. Alcohol-free Antibacterial oral rinses such as Listerine Zero or Crest Pro Health can be used to help inflammation heal. After brushing, have the resident rinse with about 2 ounces for 30 seconds, morning and evening. If the resident is unable to rinse, then swabbing the gum tissue and tongue using an oral swab dampened with the mouth rinse is sufficient. So let's review the recommended daily oral care regimen for a resident. Brush for 2 minutes, once in the morning and once in the evening. Remove food debris from in between the resident's teeth at least once a day, preferably before bed. And use an antibacterial mouth rinse after removing plaque and food debris morning and evening if needed. If a resident is uncooperative, do the best you can when you can. Some dental care is better than no dental care. On behalf of the entire senior dental care team, I want to thank you all for joining us on today's webinar. I hope you will join us next week for the next webinar entitled Removable Denture and Partial Care.